Hello, good morning, good evening, everybody. I am Vaidya Asavari Manavikar. I would like to introduce you all and welcome you all to GCAR's Global Webinar Research Series. GCAR, Global Council for Ayurveda Research, is an international non-profit organization based out of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No non-profit can operate and succeed without volunteers. So please consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and also on your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today. He is Dr. Rajnikant Patel. In 2014, he completed his BAMS from Atreya Ayurveda Medical College, Hospital and Research Center in Bangalore. Currently, he works as a Chief Ayurveda Physician at Agnivesh Ayurveda Hospital at Surat, which is 15-bed hospital, and he works with many patients who are at a critical stage. He has treated a highest number of cases of mucormycosis, commonly known as black fungus in India. He has treated more than 1,500 cases successfully with only Ayurveda medicines and was featured in BBC News. He has published total 8 cases. All the diseases are difficult to treat cases according to modern science. And there was a project. This project is supported and funded by Ministry of Ayush, Government of India. He has written many case reports by using standalone Ayurveda treatments very successfully. He is also a senior international consultant for Jiva Ayurveda Private Limited and also international panel for consultant in Easy Ayurveda Private Limited. He has been invited as a resource person for various lectures on clinical Ayurveda talk in many universities and different medical Ayurveda colleges all over India. Today, he will be speaking on a very important and very interesting topic: manage emergency and critical care in Ayurveda, a new dimension of Ayurveda. Let me hand it over to you, Dr. Rajnikant.
Thank you, madam. First of all, I would like to thank you, Council for Ayurveda Research and Dr. Asavari, madam, for inviting me for this talk on how Ayurveda can be a part of emergency or a critical care when such patients come to us. So, thank you very much again for inviting me for this talk. So, let's start. Okay. My slide is visible and I am audible, right?
Yes.
So emergency and critical care in Ayurveda, a new dimension of Ayurveda. So why we have to write a new dimension of Ayurveda? Because this is the another side of coin of Ayurveda. Because most of the people all around the world and most of the Ayurvedic doctor has means they think that emergency and critical cannot be a part of Ayurveda. Being an Ayurvedic physician or being an Ayurvedic Vaidya, we should only look for chronic disease. Or we cannot help the patient who is about to die and help them. So I have used the term, it is a new dimension of Ayurveda. Okay? So we will go deep into the subjects now. So I strongly believe that thousands of years of human observation and trial and error are far more greater than the 6 months of great experiments in the lab. So we must respect our Samhita and Shastra. I again repeat that thousands of years of human observation and trial and error, which is done by our Acharya, let it be called Charak Acharya, Sushruta Acharya, Vagbhat Acharya, Madhav Acharya, Sharandhar Acharya, whatsoever. But it is far more greater than the what modern science does by the 6 months of experiments in the lab. Because our Acharya has tried all the theory of those dhatu, everything on thousands of lakhs of people. Even they did the trial and error, and then whatever they have found in the conclusion, they have written in the form of Samhita. That's what available. That is what we have with us, Charak Samhita, Sustur Samhita. So all our Samhita is itself is a research paper, published paper. But in those times, there were no peer review, something like that, and they were too because all the acharya were apta. They were knowing everything and they have trikalgnan everything. So they write all these experiments based on trial and error, this thing, and conclusion is written in the form of Samhita. So whatever is written in the Samhita is 101% true. There is no doubt on any concept or any theory or any medicine or anything which is explained in the Samhita. So this is my hospital in the Surat. Okay. So we will be discussing few cases where this can boost the confidence of other Ayurvedic physician also, and to have a look of how Ayurveda can help in the emergency and critical care. So this is the case of esophageal necrosis. So this is the case of esophageal necrosis. So you can see the whole esophagus is completely necrosed. So here you can see whole esophagus is completely necrosed. This area you can see it is completely necrosed. So this can perforate at any time, and everything patient is eating, it will directly go into the thoracic cavity. So here you can see whole esophagus is completely necrosed. So in this case, treatment is only emergency surgery, not a planned surgery. But in this case, emergency surgery is required, and they have to cut this esophagus and join the two normal part of esophagus together. Otherwise, in modern science, they don't have any medicine to recover the tissue when there is a necrosis. So this was the case came to us with this report. So this is the before our Ayurvedic treatment report you can see. Now after Ayurvedic treatment, you can see whole esophagus is completely normal. This is normal, this is normal, this is normal. There is no necrosis in any angle in the patient's necrosis, you can see. Also, initially there was a large hiatus hernia which was present in the patient, and after our treatment, the hiatus hernia also become the small. So that you can see. So normally in modern science, hiatus hernia is a structural defect and cannot be treated with medicine. Even we believe that hernia is something like that, and it should be operated. But when this case was treated for the esophagus necrosis, side benefit we got that the size of hiatus hernia was also reduced, because in the prescription we have given Nagarjuna Ras, Vriddhi Bhadika Vati, and Gandharva Stadi Erantel, and Arboreum Plus syrup. So this was the four medicine used to increase the blood circulation in the area to clear the Srotas Aurud, and considering it as a case of Shiragatva. So this was the case. So emergency surgery was advised for this case, and patient came to Ayurveda, and after our Ayurvedic treatment, we can see the esophagus is completely normal now. Now, when we share this case to any modern physician, they are not at all ready to accept, believe that these two patients are same, because in their science, this much large area of necrosis and that too esophagus, it is 101% impossible to treat it with medicine. Only surgery, and that too emergency surgery, is the only option. So this is the strength of Ayurveda. After Ayurvedic treatment, we have you can see the report. So next case we have is alveolar sarcoidosis, which is a rarely seen case. So sarcoidosis is generally we can find, but in lungs involvement in the sarcoidosis is very rare. So 48-year female patient came with severe breathing difficulty, white coughing, chest pain since last 8 years. She was not able to do her routine work like bathing, wearing clothes, going to washroom because of breathing difficulty. She has shown to many doctors, of course, in the various cities of India, but she couldn't got satisfactory results in her illness. So she came to us, and we have started Ayurvedic treatment for 2 months. And after 2 months, there was a significant improvement in the X-ray, as well as too much. That is a significant improvement clinically also was there, because after 2 months of treatment, she was able to do her routine household activity without any disturbance. Before our treatment, if she wants to comb her hair also, if she take like this means she will start breathlessness and she might need oxygen also. So in modern science, there was no medicine. They tried all the medicine from various doctors from different parts of India, but results zero. When she came to Ayurveda, we have evidence that she improved clinically as well as radiologically. So this was the X-ray when she came to us before start commencing our treatment. That was the 5th June 2022. You can see the whole X-ray is completely blank. The lungs tissue is not at all visible. After around two and approximate 2 months after treatment given for 2 months, we can see the X-ray. The whole lungs area is clearly visible. So you can see there is no lungs is visible in this area. And after our treatment, you can see the improvement in the chest X-ray as well. The majority of the lungs area is visible after Ayurvedic treatment, and she was not having any breathing issue. So treatment we have given in this case is to strengthen the pranava srotas, rasayan chikitsa and kapshaman chikitsa. All this to strengthen the pranava srotas. So our goal in such cases in this pranava srotas, chronic disease only is we have to give a medicine just to strengthen the pranava srotas. This will automatically clear the actual disease and it will automatically breaks down the samprati, which is found in the pranava srotas. So Pushkar Mul Siddha Jal we have given in this case because it is a rule given by Acharya Charaka that patients suffering from Hikka or Swas Rog should not drink a normal water. Rather than they should drink either Pushkar Mul Siddha Jal or Dasamul Siddha Jal. Then orally Muhur we have given Chosat Prahari Pippali Lavangadi Tal Sindhu Tamra Bhasma Avipatikar Churna Chitopaladi Churna with Tamul Patra. This was given I think 1.5 or 2 hourly. Then Visivin tablet was given. So Visivin again it contains Purna Chandrobe which helps in the improving the blood circulation. So this kind of practice we were doing from before COVID also, and in COVID we got a little more freedom in our local area to intervene in ICU patient with use of Ayurveda protocol. So the first patient you can see is a COVID patient that were admitted in the ICU and on ventilator, and we have applied some powder of some herbs on the chest area. It was Pushkar Mul, Punarnava, Vacha, Haridra, Jaifal, Karkat Shungi, Shati, everything we mixed and we apply on the chest. And the second case, you can see that this boy, second number case was hypoxic brain injury, and he was also first he was in the ICU, then discharged to home because hypoxic brain injury, and he was in the almost coma stage. So external application we must start using more and more in our clinical practice, because generally we think that only in bone or joint pain only we should use external medicine to be applied. But according to me, majority of the disease we have a reference in our Samhita that there are many lepas explained for various disorders, so that can be used. So this was the case of necrotizing wound, and this lady was advised to go for a plastic surgery immediately in order to prevent a septic shock. So that was the emergency in this case, and they came to our hospital. We have admitted them for 7 days, and we have completely recovered this case without doing any surgery. So the large non-healing and necrotic wound is getting healed with Ayurvedic treatment, and in just 20 days of Ayurvedic treatment, the wound was completely filled with a fresh blood supply and healthy tissue growth was there. So here day-wise photographs are there. This was the first day photograph, and once she was admitted in our hospital, we have removed the slough tissue from the border, and all the pus pocket were opened, and whole area was cleaned using punchvolcal path. So here you can see the improvement day-wise, 4 5 days. Then later you can see fresh blood circulation is there, slough tissue is not there. Then here you can see almost the tissue is completely healthy. Here you can see, and here, and this is the brand Dukana we do. So we use Prumigna and Vishagna Dravya like a series we use Tagar, we use Neem, Vidang, Khadir, all this we use for brand Dukana on the site. So this was the actual photo before our treatment and after 2 months of Ayurvedic treatment. So I think people may not know the actual size in this photo, but I will tell this was the this much chapati like size of wound on the waist area. So that was the big size area wound in 60 plus age patient, known case of diabetes and hypertension on blood thinner. She was advised for urgent plastic surgery in order to prevent a septic shock, but completely recovered with very minimum and very easy only available Ayurvedic medicine. So we were this was the protocol being followed in our hospital. We were given first consulcal path wash, then ground Dupana with the name Bidam Khadir series. Then application of WH5 ointment after clearly washing the area with consulcal path and drying the area. Same was repeated for 7 days when she was admitted. Then oral medicine we have given Peshwar Guru, Shirish Panchangagi, Vyadhi Aran Ras, Shiva Gulika. So same medicine was given even after the discharge. So Ayurveda in osteomyelitis. In osteomyelitis, modern science has nothing to do. They have only one option is aggressive debridement of the affected part and affected bone. So this lady was 42-year-old. She came with a complaint of severe upper palate swelling, bleeding gum, first discharge from swollen gum, false smell, loosened teeth in affected part, and heaviness of the face. So she had a history of teeth removal in the same side 10 days ago. So this was the case of Abhigata Vayu Vrutti or Dukyu Garvish. So the CBCT scan was done by the this dentist. So which was in favor of either she is having cancer of maxillary sinus, or she might have osteomyelitis, or she might have mucormycosis, and urgent surgery was advised to do a biopsy and to remove the affected part of sinus and bone. But she came to us and we explained that let's start 15 days of Ayurvedic medicine, and if you don't get any improvement in your condition, then we will think about operation. But within 15 days of our treatment, there was a clinical improvement, 100% clinical improvement was there. And this patient, I think, took 1.5 years of total treatment from us, and all the necrotic bone is now completely regrown and everything is completely fine. So this was the medicine which were given in this stage. Shuddha Balatak Churna, Vilvadi Gulika, Serencotai capsule, Vyadhi Aran Ras, Triphala Gulu, Panchtikta Ghee, Khadiradi Vati, Bhadra Mustadi Kashai, Churna, and Sandhani Mahakasha and Boni Hill tablet. I think all are very familiar with this medicine. So Bhadra Mustadi Churna is from Bhaishya Ratnavali. It is indicated when the teeth mobility is lost. So teeth is movable in the patient when we give the toothbrush. We have to patient has to do with Bhadra Mustadi Churna. So this can be found in Bhaishya Ratnavali under the Mukro Chikitsa. So this medicine were not given at a time every day, but these are the total medicine which were used in this patient for 1.5 years. Sometimes we have given only Panchtikta Ghee and Khadiradi Vati. Some day we have given even 5 to 6 medicine at a time. For example, Triphala Gulu, Vyadhi Aran Ras, Serencotai capsule, Boni Hill, Sandhani Mahakasha was continuous for many days. So like that. But this was the total medicine used in this case. So before treatment here you can see this is the removed teeth, and due to this infection has spread to the whole area and necrosis of bone was started. And she was advised to remove all this teeth, line of this teeth and upper palate, this side of hard palate. So this is the same photograph from other side. You can see the wound means the pus formation in the osteomyelitis. You can see false smell. It was discharge was there. So before treatment, while treatment, you can see the difference of this area and this area. Now this is almost 80 to 90% completely healed, and latest image of this patient you can see here. The area is completely normal. So that was the clinical improvement we talked about. So now we will see the radiological improvement which was found in this patient. So before treatment, you can see this bone, maxillary bone was completely lost due to the necrosis. So here also the bone loss is there in the CBCT scan. So normally this should be like this color. This color should be here, yellow, yellow color, dark color. But due to the necrosis and osteomyelitis, uh, you can see the bone loss was there. So this was the before treatment. And after treatment, you can see the new bone is grown here and here also 80 to 90% new bone growth is there. So here you can see and here you can see. Here you can see also 90 to 95% bone is completely grown. So this is totally impossible for modern science. Chances are very, very rare that to grow a new bone in the place of necrosis bone. Because they have only one option is to remove this complete area, and here they have to remove this side of complete teeth and this area. But with Ayurveda, without removing the teeth, without going for any operation, in very low cost treatment, she survived successfully. So this is the case of hemolytic uremic syndrome, again a critical or the emergency situation where hemolysis continuously happens in the renal circulation. So 29-year-old female patient came and she had a history that 10th March 22. She got a high grade fever with rigors and went to their general physician and started the treatment, and she suddenly observed that she is passing a orange color urine. So she was admitted, and where upon the investigation they found that her HB is 3% and platelet is 25,000 and serum creatinine was too high, that is 3.5. So based on these clinical findings and this investigation available, she was diagnosed as a case of hemolytic uremic syndrome. So in this, urgently they have started to do dialysis and plasma therapy to reverse this thing. So total 8 dialysis and 6 plasma therapy was done. Then she was in a good clinical condition. So they discharged her, and after a few days, again she started passing yellow, this orange color urine. Then someone referred to our hospital, and we have started Ayurvedic treatment for 2 months. And without a single dialysis and without a single plasma therapy, her HB level and platelet level become normal. And creatinine level was little high, but still it was gradually improving. So here you can see even in spite of doing dialysis and plasma therapy, her hemoglobin level was not going more than 9. But when she came to our hospital for Ayurvedic treatment, her hemoglobin level was 7.8, and after our Ayurvedic treatment, it was went up to the 12.7 without any dialysis or without any plasma therapy or any iron supplement. Okay, that is the important, without any iron supplement. So platelet count even after dialysis and plasma therapy also there was no improvement in the platelet level. When she came to our hospital, 81,000 platelet count was there, and after our treatment, you can see 22 lakh 11,000 platelet was there. So how to apply the Yukti in such cases? For example, in this case, understanding of the disease was done based on the model pathogenesis, and treatment was done on the basis of Vish Chikitsa. Because what modern medicine book says is, in some case, E. coli bacteria produce the toxin called Shiga toxins in the blood. So there will be GB3 receptor all around our body, in the body, all the organ. But GB3 receptor will be more in the renal tissue. And Shiga toxin has a high tendency to bind with GB3 receptor. So now once this complex is getting formed in the renal system, Shiga toxins and GB3 receptor are getting connected, it will lead to the activation and deactivation of such a factor which are responsible for blood clotting mechanism. This will lead to the continuous lysis of the blood which comes into the renal system. So whatever blood comes to the kidney for filtration, hemoglobin and platelet will be broken down and it will be passed in the urine. So the urine will comes into the orange or red color. So very simple medicine were given in this case, and you can see Shirish Prop Churna, Bilwadi Gulika, Nagarjuna Ras, and Vasti Amantikki. So these four medicine were given for 2 months, and again 1 or 2 months we have started continued, but after 2 months, every report was in the normal range. So this was the eye emergency. So 60-year male patient came with a complaint of severe first discharge, which was sticky in nature and white in color from right eye since 30 days with redness, pain, and loss of vision. So where he was taking treatment, their bacterial and fungal culture was done from corneal discharge, and it was found that there is a heavy growth of Streptococcus pneumonia, which is a gram positive one. So and no fungal element was seen. But they were interested to start antifungal medicine because with antibiotic he was not responding. Even though there was no fungal element was seen in the culture, still they have tried fungal medicine also. So patient had taken both antibiotic and antifungal, both oral and IV, as well as eye drop also, but he was not at all responding to any treatment. So, as he was not responding with this severe infection of eye, surgeon advised for a inoculation, that is a removal of the complete eye globe or eyeball. So they explain patient that if you don't remove your eye now, the chances of infection invading into the brain or a skull bone is very much high. So they were given only one option to remove the eye quickly. So of course, nobody will directly remove the eye. They will take a suggestion from other alternative treatment if available. So patient was not ready to remove the eye, and they came to our hospital for Ayurveda treatment. And we have given treatment for 45 days, and within 45 days of an Ayurvedic treatment, he feels very good improvement and in his eyes, and almost first discharge and everything was completely gone. Interestingly, this patient has visited same ophthalmic surgeon after our treatment, and there the ophthalmic surgeon told that you need not to remove the eye now. You please continue Ayurvedic medicine, whatever you are taking. So I will play a video. Can So this was the before, and this is the after. You can see. This is the before. You can see the even there is a eyeball is little bit shrunken. Proptosis is there. I will show you the proptosis. So here in this area, you can see the whole. You can compare the size of eyeball. In this, you can see the size of eyeball. In this, you see this is little bit normal. This is shrunken eyeball, and here you can see the gap of the area inside this eyelash. So that was the this thing, and after treatment, it was corrected. So again, here we will play a video. So you can see before Ayurvedic treatment, and this is after Ayurvedic treatment. Even though we couldn't restore his vision completely, we have saved him from removing his eye, and his eye is completely now normal, and vision loss is there. Little bit you can see. So medicine, if we talk about medicine, then fresh breast milk as well as Netra Sudarshanar were used as an eye drop. Gandhak Bhungraj Vati tablet was used. Dhupana of Khadir, Bidang and Shirisha were given on the eye. Panchashirish ghee were used. Bidang and Khadir Siddha Jalpan were given to clear the krumi. Amrit Balatak Avle to reduce the Kledatva in the body. Shuddha Bukuru to clear the aura if any. It could be the Vatika for krumi. Because Kafaja Krumi eats the eye. That's what we have a reference in this Sushrut Samhita. Netrada Krumi, one of the type of 10 Kafaja Krumi. So here is another interesting case where he was advised for aggressive operation to remove the palate bone and sinus bone. So he was a patient of diabetes. Here you can see diabetes and chronic renal failure. So these two comorbidity were there, and he was advised to remove the upper half palate completely with all the teeth, 10 or 11 teeth, and sinus surgery. So the left Patel, this fungal, this KOH preparation was done. It is like culture. So he was a positive for fungal hyphae resembling to a zygote or mucor. So this was the case of mucormycosis, biopsy proven case of mucormycosis. So here you can see the note by your head and neck, this skull major surgeon that surgical debridement is the only option available for this case. In this condition also when he is having diabetes and chronic renal failure. So this case we have taken up and completely this case is now completely clear. Even medicine is stopped. So you can see the date here, 2nd March 2024 and today is I think 19th August. So now he is not taking even Ayurvedic medicine and completely normal. Even his affected eye, he was having a internuclear ophthalmoplegia. So his eyeball was not at all able to move. So they advise after this surgery, after few days, they will have to remove his eye also. But with Ayurveda, completely recovered. So here you can see the necrosis and the osteomyelitis of a hard palate due to the fungal infection, mucormycosis. So he was advised to remove this much area, all this teeth and this thing. After Ayurvedic treatment, you can see the complete recovery of this area. You can see. So even this case, when we show to any modern medicine doctor, they are not at all ready or they don't trust this case that this kind of thing in the mucormycosis, in osteomyelitis is not at all possible to clear this thing with medicine and this surgery is the only option. But with Ayurveda, you can see. So this is the real strength of Ayurveda. These are the deadliest diseases in the modern science. They don't have anything to do. Only surgery is the option. That too, patient require 20 to 30 or 40 lakhs rupees in some case of mucormycosis. And after spending this much money also, they are ending up with removing the eyes. Even some patient died after taking 30 to 35 lakhs rupees of treatment. In these cases, Ayurveda treat it very easily. So this is the real strength of Ayurveda. So here is a children, a boy. His age was only 7 months 23 days. So let's consider this age 8 months old baby. So he was having a history of cough and cold since birth. But when she was taken to hospital, there it was since 6 days. So he was not responding to any medicine. So chest X-ray was done, which shows the eventuation of diaphragm. X-ray and sonography was done. So as the eventuation of the diaphragm is the surgical this thing only. When if a patient is having a breathing difficulty and cough and cold for continuously and is a known diagnosed case of eventuation of diaphragm, open thoracic surgery is the only option to repair the diaphragm. So they have advised surgery for this 8-month-old children baby to go for a open thoracic surgery. They will open this. They will correct the repair the diaphragm. So he was referred by pediatrician to a pediatric surgeon to do a surgery. So here is the note of same doctor who is also this pediatric surgeon. So after doing CT scan, he advised that open thoracic repair. So this was the treatment advised in this boy that he required open thoracic surgery urgently. And they have explained that this diaphragm is this side upper this moved upward, and after doing surgery, this diaphragm has to be pulled down and repair must be done. Then only he can get recovery in the coughing and cold and everything. So after Ayurvedic treatment, so I think 3 or 4 months of Ayurvedic treatment, you can see the before Ayurvedic treatment. So here you can see the diaphragm is too much upward. You can see here. So this is the diaphragm. You can see completely. Sorry, 1 minute. So here you can see this is the whole diaphragm. This is completely moved upward, which is causing pressure on the lungs, and baby is getting more cough and cold. So this needs to be corrected by doing open thoracic surgery, and this diaphragm has to be pulled down here at a normal place, and they have to repair it. So this is structural deformity, only surgery is the option available, and in case if patient is having breathing difficulty, cough, emergency surgery is required even if baby is 8 months old. So of course, no parents will directly go for a surgery and that to open thoracic surgery for his 8 months old son. So after Ayurvedic treatment, you can see the diaphragm is, I think, 40 to 30 to 40 to 50%. We were successfully brought down the diaphragm down with Ayurvedic medicine. So when we make a line to the diaphragm, this thing. So here is the diaphragm goes here, this line and this line you can see. It is totally this means majority of the diaphragm is Ayurvedic medicine pulled down. So this is the Vata Prakopa. So Chuth, we have a reference in our Samhita that Anga Chuth, Buddha Chuth, like Buddha Brahms. So any organ which moves from its normal side in a abnormal way, it is a Vata Prakopa. So treatment of Vayu can bring down the diaphragm to its normal position or normal level. So medicine, Sahacharadi Tel, Abhyang and Swedan was given and Savardhan ghee orally were given with the Balchatur Badra syrup and ras people. So, as I said, I highly believe that thousands of years of human observation and trial and error are always far more greater than the 6 months of rat experiments in the lab. So, we must respect our Samhita and Shastra because why I am getting success in such cases is due to reading of Samhita. If I would have not read the Samhita, then I would have not able to treat this kind of difficult cases. So we have answer for all the disease. So what emergency or critical care, what they people say, conventional medical doctor, it might not be emergency or critical in Ayurveda if we see in terms of our Ayurveda. So we must respect our Samhita and Shastra and we should apply this practically in the patient, then we can even treat any level of the critical cases. So thank you very much for listening me and I again once again thank you Madam and Global Ayurveda Research for inviting me to talk on this platform. Thank you very much.
Thank you so much for such an excellent presentation with so many different case studies, and not only the surgery was avoided, but also those people, they were able to heal completely with Ayurveda, which is absolutely amazing. Incredible. Thank you so much.
Thank you.
Anybody has any questions?
Very excellent presentation. And yes, definitely, Ayurveda can be or should be the answer if we read our Samhitas. And in between the lines is, in my opinion, most important because we can handle any kind of emergency. And I think so in Maharashtra, so many doctors or so many, sorry to say, Vaidyas, including our late Yego Joshi sir, then Vaidya Trilok Dhopeshwarkar from Pune. He has handled so many emergencies, accidental cases also. So there is definitely strength in Ayurveda, but we must know it and we must consider it as our excellent tool to help community. I think so, that's my opinion. And another thing, in hiatus hernia or in any hernia, our Vaidya Shende Shastri, late Shende Shastri, used to give Tailapan also. And in that, Mushak Tel, I treated hiatus hernia cases of 4 to 5 patients only by giving orally Mushak Tel.
Very good.
So that is also, I want to share this thing. So very excellent presentation. And definitely we will meet one day in person.
Sure, sir.
Thank you. Thank you so much for sharing. your experiences, Dr. Patel. Thank you. All right. So thank you so much for attending our webinar, everybody. Please watch and also subscribe to our YouTube channel to view the earlier webinars and also other presentations. Please like, comment, and share the videos with others too. Once again, I invite everybody to become a member of GCAR, and also fill out our volunteer form. You can also subscribe to our IU update. So that is our newsletter that goes on to stay tuned with our projects as well as various events that we conduct at GCAR. So if you have any questions or any comments, please feel free to contact us at ayurvedaresearchusa@gmail.com, or you can also connect with me at asavari@mnayurveda.com. Thank you so much.
Thank you. Thanks.
We'll definitely meet in person sometime.
Sure.
Yeah.
Thanks.
Thank you.